my name is Jessica. This is a core values blog. When given the option of doing video or written, I of course chose doing video. I've completed the core values questionnaire, reviewed the ANA Code of Ethics, reviewed the story of Jaha McMath. We'll talk about 2 of the AONE Nurse Executive Competencies and 2 of the ANA Scope and Standards that might have been challenged by my values that serve the basis of making care decisions. So when it comes to the story of Jaha McMath, what a very unfortunate story it is. This 13-year-old that was going in for tonsil surgery ends up having a hypoxic or anoxic brain injury. You could see in the video published by CNN that the mother was very emotional, who could blame her for a simple surgery that was supposed to go correctly. I work in a neurocritical care unit where we see brain death testing on a regular basis, and I have heard the same response that the mother had several times before, where she was saying, how can they say that she was brain dead? Her heart was still beating, her blood was still pumping, she was still warm, she moved when I talked to her. All these things are things that I've heard before, and reflexive behavior. As we know as healthcare professionals, there's 2 different types of death. There's cardiac death and brain death, and in this situation it was definitely brain death. Mother was not accepting and has not went through the process even, I think, processing this. So when it comes to the ANA standards of the scope and ethics, after reviewing all this, there's several things there's 2 that's very important that at times kind of get compromised, and that is the conflict of interest for nurses. As nurses, we want to treat our patients and hope that they get better. When brain death has been occurred, or like in this situation has been confirmed, ultimately all we're doing is keeping the body alive. So that it can be an issue. Also, professional boundaries. That is one that you have your families up there for a long time, and you're their support system, and you almost fall into their conversations as, oh yes, you squeezed my hand. It's hard not to give that glimmer of hope, because as nurses we like to promote and advocate and hope that help is in return, but at times you know that isn't. And it's for respect for human dignity. That also goes back to knowing that all that's keeping this person alive is drugs and a ventilator. It's hard to continue to do all these things for this patient that's brain dead. According to the AONE Nurse Executive Competencies, things that might challenge values that serve for the basis of managing care, probably risk management would be a major one. As a nurse that's dealing with a patient that's brain dead and you're keeping all these drugs, keeping the person alive, if your medications that you're keeping the person alive with runs out, then ultimately the patient will code. It's a major issue. I've seen before that a family hadn't accepted that the patient was brain dead, and we had to run a full code on them. And it's hard to keep somebody that's brain dead alive, if that makes sense. So it is then that a decision has to be made quickly. Another thing is effective communication. It's hard not to be persuasive with your words when dealing with a situation, and it's hard not to be biased. And that also goes into saying influencing behaviors. It's hard not to give your opinion what you should do. According to the questionnaire core values, the 2 that I had left was love and family. I can directly relate this to the Jaha McMath story because of the love that the mother had for her daughter. You could see the pain, you could hear the pain in her voice. I can directly relate to that because my core values is with my family, and I don't know if I would be so easy to let them go either. According to my article for diverse and culturally competent workforce, I reviewed an article based off of recruitment and retention of diverse workforce, the challenges and opportunities. This was published by Valerie Myers of 2007, volume 52. The generalized idea of this was that it suggested that having a cultural diverse working staff helps take care of a culturally different patient population. On page 292, it stated that with having a diverse working population, it helps exceed high quality health services. I know from personal experience with having a diverse workforce, it helps with dealing with diverse populations. So it helps not only as a staff become a little more culturally competent, but it helps our patients feel a little more comfortable when they see that we have a diverse staff as well. I will post my resources and references along with this video. I thank you for this opportunity.